A force field analysis is useful when considering what goals a facility has and then identifying for each goal what factors are contributing forces to change and what factors are opposing forces to change. For Good Times Hospital, on the post-surgical unit, the goal is to have 0% falls post-surgery. Some of the factors which are going to be contributing forces to change or things that help change occur for this unit will be motivation from nurse managers and administration in order to promote fall prevention because they are experiencing a decrease in insurance covering costs and they want to increase the cost of care which insurance will cover for these surgical candidates. Additionally, the administration, the nurse staff, the doctors all want to increase and have motivation to increase patient safety. This helps improve their reputation as well as it makes the patients feel more cared for during their stay. Lastly, some of the contributing forces to change is to reduce the complications for care. Again, the stakeholders in this community, in this hospital, would like to reduce complications post-surgery. They like to give the best care to their patients, and therefore they're motivated internally to make sure that their patients are properly cared for. However, the opposing forces to change will make it more difficult for them to reach their goal. One of these is the lack of training resources. While they did implement training on how to ambulate patients post-surgery, there's still a variety of other topics which will need to be covered, such as proper pain administration post-surgery and proper assessment of patient sedation levels post-surgery as well. Second, the expense of the equipment needed will be a burden to making this change possible. The unit needs more wheelchairs, gait belts, and walkers, and it's questionable whether the hospital will provide this sort of funding for these additional pieces of equipment. Last, one of the opposing forces to change is a lack of physical therapists. While the unit may have a goal of hiring more physical therapists for their unit, this might not occur as quickly as they would like to happen. So their goal of reaching a 0% fall post-surgery might take a while because of the lack of physical bodies on the floor.